So, welcome to the fourth video of our Nerdy Scientist YouTube channel. This is on the recent developments in COVID-19 research till May. In the month of studies, what we actually came through in the reputed journals like Nature and elsewhere, and we have come up with few studies, and I hope you all love it. So let's start off. So now the first one. How deadly can a COVID-19 be? What is the actual detection? We know COVID-19 is a virus. It's an RNA single-stranded virus, and it is infecting the lungs. It's attacking the lungs, targeting the lungs, and finally the lungs are getting completely dysfunctional. And at that point of time, slowly the immunity goes down, and the patient may die. That's all the stages what COVID-19 has. Now, talking about what is the severity of it, based on the surveys, based on the patients, the millions of patients have been infected at present in all over the world. What is the rate? Basically, this study is actually explaining to us. So, infection with novel coronavirus can lead to coronavirus diseases. This can cause mild to severe symptoms. There's a range. In some people, it leads to life-threatening complications. COVID-19 can be deadly for some people. Older adults and people with existing health conditions are at more risk of serious complications, which can be life-threatening. So, according to WHO, about 80% of people who develop the disease have mild to moderate symptoms and fully recover without needing treatment in a hospital. This is really very important. Without needing treatment in a hospital, a patient can fully be recovered. Roughly 1 in 5 people experience serious illness. Very serious illness. 1 in 5. The ratio is very small. So here they are saying that older people are at risk. That doesn't mean that younger generations or the middle-aged people are not at risk. They are too. Based on the present scenario, as the old people are very much poor in immunity comparatively to the healthy young age people and middle aged people, their immunity is poor for a healthy the old age people. So it's important that they need to be taken care in a very different level, in a higher level compared to the younger generations. So it's important that both all generations, all the age groups actually be prepared, be protective of yourself, be very much eat healthy food, be fit, do some exercises, because immunity is everything. If you are very much immune, if your body is immune, you are completely healthy. No virus or no bacteria can infect your body. So it's important to maintain immunity irrespective of what age group you are. So that's what I want to tell you, because some people may actually go get deviated with that kind of terminology, like saying that older adults are actually mostly affected. Every age needs to take care of themselves. So the next one, another study talks about no link between hypertension drugs and COVID-19 risk. So there were few instances where scientists actually said that antihypertensive drugs are actually useful in treating COVID-19, but actually a study has proved, the American College of Cardiology, American Heart Association, and the Heart Failure Society of America issued a joint statement urging researchers to address certain gaps in our understanding of COVID-19 risk. So there were many medical professionals and patients alike that common drugs for lowering blood pressure are not linked to an increased risk of COVID-19. More specifically, the ACC, the AHA, HFSA pointed out a need to clarify whether or not people who have taken antihypertensive medication, that is the drugs that help lower blood pressure, are at higher risk of developing COVID-19 or experience a severe form of the disease. So according to the reports, according to the study, the people who are actually having a low BP are not, or they're having high BP, they are not at risk of COVID-19 at all. There is no risk, there is no connection between the COVID-19 infection and blood pressure. It's completely two different topics, and these kind of deviations actually result in a lot of complications. So it's important that these studies need to be discussed, and that's the reason why we actually decided to keep this study in our presentation. So yeah, blood pressure is not related to COVID-19 risks. The next one, tiny airborne particles may carry the new coronavirus. So, a study in Wuhan, China detected genetic material of the new coronavirus in airborne suspensions. Very, very, very important, guys. People don't know about this. I need to explain this. Genetic material detected there of a new kind of coronavirus in airborne suspensions or aerosols in hospitals and public spaces. The finding reinforces the importance of thorough sterilization of infection hotspots, good ventilation, and avoidance of crowding. To date, this month of May, scientists have established three ways in which severe acute respiratory syndrome coronavirus 2, the SARS-CoV, the virus that causes coronavirus disease, can be transmitted. There are three ways. The first one is inhalation of liquid droplets from the coughing or sneezing of a person with the infection. You know this. The second one, close contact with a person who has the infection. You know this. Third point, contact with surfaces that contain the virus. You also know this. The next point, according to recent study in China, aerosols may offer a fourth transmission route for the virus. You know what is aerosols? Airborne particles which are present in our atmosphere, in our environment. So these aerosol particles or suspensions or airborne suspensions which we cannot see with our naked eye, if you actually breathe in, the COVID-19 can be transmitted, and this is very, very, very important and very crucial study which can actually explain the importance of aerosols and what role these aerosols can play in transmitting COVID-19. I actually urge you all to go to this topic. You just type the title there, what you could see in the slide, and in the Google search, and you could actually get the paper, the complete paper which discusses about these airborne particles like aerosols, which can transmit and infect the COVID-19 patients. It actually gets spread into the community where you live. So staying at home does not completely say or certify you that you cannot be infected. So it's important that complete ventilation is there in your house where you actually live, and try to avoid going out. That's what are the suggestions. The next one, the novel drug candidate against novel coronavirus. A new drug candidate has actually been included. So a team of scientists from China has found a new candidate drug against the novel coronavirus SARS-CoV-2, which works by inhibiting a key part of virus machinery. A very, very important part of virus machinery is actually being targeted by this drug, and much of the world is on hold until scientists find a vaccine for the novel coronavirus. We know that. However, with current estimations suggesting that a vaccine is 12 to 18 months away, it takes minimum to 2 years, minimum 2 years. But as it is very alarming, the COVID-19 is very much spreading at an alarming rate. It's important that we actually increase the rate in which we conduct clinical trials in the labs, so that we get the vaccine very fast. So many people are placing increasing hope on effective treatment of COVID-19. So for this reason, people have been eagerly awaiting the news on Gilead's experimental Ebola drug remdesivir. We actually, in our Instagram page, Nerdy Scientists, we actually explained about remdesivir 2 days back. And if you could go and check our Instagram page, Nerdy Scientists, you could get more information about remdesivir. This is the new drug which will actually prevent coronavirus. And there is a lot of talk and discussions going on this drug. I hope you all go and search for yourself and get to know about it. So this is actually causing real efficacy in the patients, and it's improving the rate of treatment for the COVID-19 patients. So yeah, very important and interesting facts and studies. So just go through all of these. The next one, how COVID-19 affects women's sexual and reproductive health. Very another interesting study. Here we look at how the pandemic is affecting women's sexual and reproductive health in the United States and across the world. So the coronavirus pandemic has affected people differently based on their sex and gender. We actually observed it. We have been seeing in the news channels, and as we explained in our previous no in the featurette, if you could go to the Nature Journal, you could actually find another featurette where they actually explained about how gender has played an important part in primary and secondary impacts of the current health emergency. So gender is also playing a very important role in COVID-19 infection, and the rate at which the women are getting affected is little bit high compared to the men. The cause we don't know, the reason we don't know. We need to go forward and do further research on it once we get a vaccine or a drug completely confirming that it can prevent COVID-19 infection. We can move forward and do what is the reason why women are getting actually affected more due to COVID-19 infection. However, on a societal level, the pandemic has had a range of serious consequences for cis and trans women everywhere, including the higher risks they face as a result of their traditional roles as uh, carriers, the rise in domestic violence, and their lack of decision making power in their own sexual and reproductive health. So, all these things are being affected in cancer patients according to the survey, according to the observations and experiments the scientists have done on few COVID-19 cancer patients. So we have to do a lot more research on it, so to come into a conclusion, I actually hope that we come to a conclusion very soon on this subject. Another one, are blood clots to blame for COVID-19 deaths? Are blood clots related to COVID-19? So various research teams have actually suggested that the blood clots play a significant role in why some people become seriously sick with COVID-19. The death toll from COVID-19 continues to rise daily. As we know, it's in a massive way. Millions of people are getting detected. Many lot of number of people are getting um, actually being dead because of this COVID-19, which is the 19 strain of SARS. So the new coronavirus that caused the disease actually causes death remains poorly understood. The actual cause of death, no one knows. We have still do a further research. A lot of extensive research needs to go on to come to a conclusion. So what is the machinery of COVID-19, the mechanism of action, and what is the reason of death of a patient suffering with COVID-19. So clinical reports show that people with severe COVID-19 develop pneumonia, acute respiratory distress syndrome, and multiple organ failure. So age and underlying medical conditions are factors that increase a person's risk of severe diseases. In a collection of articles published in Journal of Radiology, experts now highlight that a significant proportion of those with severe COVID-19 show signs of blood clots, which can lead to life-threatening complications. So everyone suffering with COVID-19, many people are getting out of it. But after they get out of COVID-19, there are various life-threatening complications which are going to happen because it's related to blood clots. You know how dangerous blood clots can be. It can actually cause death of a patient. So all those things will not be recorded under COVID-19 deaths. Remember that. So the lot of complications if you actually get infected with COVID-19 can happen, including blood clots. It's one of the major complication. There are more to come in future if we actually get a lot more research studies published in few more months. So yes, at present, blood clot is the most important complication, life-threatening complication, which can be caused due to COVID-19 infection. So we come to an end of this video. I hope you all loved the video, enjoyed the video, learned something from it. So be healthy, be safe, do take care of yourself, your parents, your grandfather and grandmother, grandparents. So I'll meet you again. Do follow our Nerdy Scientist Instagram page. Do follow this YouTube channel if you loved the video, and subscribe this YouTube channel for more updates on COVID-19 cancer or any other research studies what we could actually produce before you. So thank you for watching. See you. Stay tuned.